This is Dr. Dipti, and I'm a practicing orthodontist in Abu Dhabi. Today, I'm going to talk about what to expect at your child's first orthodontic consultation. This should help prepare your child and yourself to make it an overall better experience. Okay, so the first thing that I'm looking at is how comfortable the child is in the dental chair. If there's any past history of poor experiences or any phobias that are passed on from the parent to the child, we want to address those first because orthodontic treatment for the most part is elective and not an emergency. The second thing I'm looking at is overall dental health, which means the absence of any cavities, good oral hygiene, good gum health, and a healthy mouth. The third thing I'm looking at is their developmental status. So when I say that, I mean I'm comparing their chronologic age, which is their age in years, say 7, 8, 9, whenever they present, their dental age, which is basically based on the development of certain teeth and their tooth roots, which allows me to see if that child is early in eruption, which means teeth are coming in sooner than the normal timeline, or delayed in eruption, which is generally fine as long as the sequence is right and it's not delayed beyond 2 years. And the third age that I'm looking at is the bone age, which is the skeletal age. The bone age is very important in children because in many of them, we are looking at modulating or adjusting the proportion of the upper and the lower jaw to each other. And we want to make sure that any of these adjustments happen during the time that they're still growing and that they haven't really finished that phase of jaw growth. So, which is why the bone age is important. So that's the thing that I'm looking at with respect to age and eruption of teeth. In addition to this, I'm obviously looking for their bite, so a deep bite, a cross bite, which is considered the only orthodontic emergency, any spaces, impacted teeth, and so that's a quick clinical check. In children, I'm also looking at any functional interferences such as a narrow upper jaw with a restricted airway, tongue ties or lip ties, which are causing functional issues. And these are best corrected at the right age so that growth can take over and improve overall function of teeth and jaws. Decide that it is a good time to go ahead with the orthodontic treatment, then we may proceed to the next steps, which is basically collecting data at this time point. So there's some radiographs of the skull, there's a scan of your teeth and some pictures of your teeth and smile, which serve as a start point for a study in order to plan the orthodontic treatment in detail. Overall, this takes about 20 minutes. There's no pain whatsoever, and is generally a happy, quick appointment with nothing scary. So I hope that was helpful, and let me know if you have any questions.